Lindsay had a question about cyst formations in the spinal cord and brain. She says, my husband has a large meningioma removed from his spinal cord 7 years ago and has now discovered a cyst that has grown inside the brain stem. It's putting pressure on all his nerves. He's now numb on his right side and losing motor functions in his right hand and arm. So he had brain surgery where they removed part of the base of his skull to alleviate the pressure from the cyst. However, several months later, the cyst has not shrunk or dissolved. His numbness and motor function have not gotten any better. Can this be helped at all, or is the nerve damage irreversible?
Well, let us hope the nerve damage is not irreversible in this case with cyst, or in a case with a tumor, it would be the same thing, be it malignant or non-malignant tumor. But a scar tissue would determine whether or not the amount of scar tissue, where the scar tissue is, if the nerve would come back again. Because nerves, like any part of the human body, regenerate, and regenerate well and effectively, and more rapidly in some cases, if you're doing all the right things. First right thing you do, besides the obvious, eating properly, is use non-invasive electromagnetic therapy. And non-invasive electromagnetic therapy stimulates neuron activity from the brain and from the body to the brain, so the pathways that are now starting to be blocked by the pressure and by the density of the tissue mass, in this case a cyst, are starting to erode a little bit. So we're pushing them out of the way and making the neurons or the nerves work better than they have been. That's number two to diet and lifestyle. Another thing one must understand is that certain kinds of body work, certain kinds of therapeutic body work, more so than rubby feel-good body work, like neuromuscular done properly by a well-trained, well-experienced person, could be very important in this process. And why? Because that, along with a very well-trained lymphatic drainage person, they get the immunological system to kick in, the muscles and the neurological system to kick in much better, much more effectively by the stimuli that are caused by these two therapeutic processes. So we'll review it again. First and foremost, it's a pure, clean diet that nourishes the body, eliminating, of course, all the causative effects of why this may happen. Number two, you would actually be worrying about getting the electromagnetic non-invasive. In most parts of the world today, you can find medical grades, high levels of electromagnetic therapy. Number three, then body work that really is therapeutic, like neuromuscular work and lymphatic drainage, could be helping. Now, on top of all of that, a secondary level that you may move to is certain hormonal balancing supplements. We have created one years ago called LifeGive Hormone Power. When we've seen people with these type of growth activities, we've literally realized that that has been the most important thing to expedite the process of reversing these. Now, that in and of itself wouldn't do it. If you're out eating McDonald's and drinking beer, save your money. But if you really are serious about helping to reverse this potentially, then what you do is you would take hormone power along with it. I don't know if he's overweight or underweight, but we see the less fat you have on the body, which is mostly there from saturated fat, your own or eating animal fat, the better it is to remove and reverse cystic conditions. Sadly, and I don't want to put a kink in this, but I have to be candid about it, the talk on the street up until very recently was if you had cyst, it had nothing at all to do with cancer. I suspected, and actually was bold enough to speak about that for 25, 30 years now, that yes, it does have something to do with cancer, and the Japanese just confirmed it. That in most cystic conditions, you have a much higher chance of contracting cancers or tumors, if not cancers, because you've had cysts in the past.